Thank you for joining me for this presentation on a population at risk, including those with eating disorders. My name is Jessica Copley, and I'm an LPN to BSN nursing student at Indiana State University. After presentation, the observer would be able to discuss the difference between types of eating disorders, including anorexia and bulimia, describe the strategies to recognize those at risk for eating disorders, identify common risk factors for eating disorders, identify health problems among those with eating disorders, educate on the importance of seeking help, and be able to plan interventions to assist those in need. At this point, please pause the presentation, take the pretest, and then resume once finished. Eating disorders to consider include anorexia, which begins with a slow decrease in calories due to the fear of gaining weight. Losing weight becomes an obsession. This may be a single episode of serious weight loss followed by recovery, but can also be a continuous battle. These individuals see themselves as overweight, even with dangerously low BMI. Those with bulimia binge eat and then purge to prevent weight gain. This often includes self-induced vomiting, laxative use, diuretics, fasting, or excessive exercise to control weight. These individuals may be underweight, normal weight, or even overweight. Important statistics to remember include anorexia affects 0.5 to 3.7% of females, commonly beginning between the ages of 12 to 14. Bulimia affects 4 to 15% of females, predominantly starting in high school and college. While individuals with eating disorder are predominantly women, males make up 5 to 10%. Both males and females are predominantly white. The range is so different because it is very Warning signs to consider are that eating disorders are often triggered by developmental milestones or events, including puberty, the first sexual experience, if the individual is ridiculed for their weight, starting college or really any schooling, death of a loved one, sexual abuse, or physical abuse. Personal traits that can often lead to an eating disorder are those who are perfectionists, have low self-esteem, are highly stressed, have poor coping skills, poor self-image, and those who are dependent on others' opinions. Professions that have a higher rate of eating disorders include models, dancers, cheerleaders, and flight attendants because these professions emphasize appearance. But naturally, these are not the only professions with those with eating disorders. It can be any individual. Signs and symptoms of anorexia include extremely restricted diet, extreme thinness, an obsessive need to be thin and unwilling to maintain a normal or healthy weight, intense fear of gaining weight, discouragement, and denial of the serious low BMI. Health complications with those with anorexia include menstruation stopping. Your body compensates by slowing down processes, including blood pressure, heart rate, and respirations. The thyroid activity slows down. Bones become thin. Hair and nails become brittle. Skin can become dry and yellow. They experience fine hair growth all over their body. The individual can suffer from severe constipation. Not eating and severe weight loss can damage the structure and function of the heart, can cause brain damage, multi-organ failure, a drop in body temperature, being very tired and infertile, and 5 to 10% of those with severe anorexia can pass away. Health complications with bulimia include electrolyte imbalances, which can lead to heart attack and stroke, fatigue, seizures, muscle cramps, arrhythmias, decreased bone density, a chronically sore throat from induced vomiting, swollen salivary glands, worn tooth enamel, again from vomiting, as with acid reflux, intestinal distress and irritation due to laxative use, and severe dehydration. Support includes long-term treatment, including nutrition counseling, psychotherapy, behavior modifications. Those with serious complications with bulimia and anorexia can be hospitalized. With both eating disorders, it's really important to either self-help or have a support group. And sometimes medications such as antidepressants, antipsychotics, or mood stabilizers can help stabilize those with eating disorders. It's important that if you have an eating disorder or know somebody who has one, that we support them. There's online chat that can be accessed. You can call 800-931-2237 or text that number for assistance. It's important to make a difference, not just those in the nursing field, but anybody who has a loved one with an eating disorder. It's important that we're able to implement and support these individuals. Nurses should be aware of the American Academy of Child and Adolescent Psychiatry. This is for both families and youth, and we should be encouraging mental and health treatment and support for family as well as medication adherence. If you believe somebody may be suffering from an eating disorder, you can support them by showing them a quiz to take. They might not want to take it or acknowledge that they have an eating disorder, but if they are there for an assessment, it's a good one to take, the eating disorder examination questionnaire. References that support this research are the textbook, as well as the NIMH is a great resource. Those who are looking for more information can go to the NIMH for psychotherapies listed and support, as well as a support group on that website. Thank you for joining me. At this point, please take the post test, and the outline is also available. Thank you.